I am Dr. Dinesh Kale, Professor of Orthopedic at JN Medical College, Belagavi and the KLES Hospital. Now this is a 2,400 bedded hospital. It's a high-tech hospital. I have been specially trained in pelvic acetabular surgery at University at Vanderbilt, Nashville, USA under Dr. Philip Krieger. After I had my training at Vanderbilt University, Nashville, I have so far done 74 acetabular surgeries and 47 pelvic surgeries. I have myself modified a screw that is called as a sacral screw. It is unique in nature, and all the pelvic acetabular surgeons across the country have now been using it for the past 4 years, and they have found it extremely useful. Incidentally, I am the past president of the Indian Association of Pelvic Acetabular Surgeons. These surgeries do require a lot of effort, and the learning curve is very steep. This is always a teamwork. One single individual surgeon cannot do it. This is a young boy of around 19-20 years who had met with an accident somewhere between Karwar and Mangalore. He had sustained multiple injuries. The most important injury was his injury to his pelvis. He got operated for his limb injuries. The patient was in shock, so his pelvis could not be handled at that time. Subsequently, the patient was asked to go home and take rest and consult some other pelvic acetabular surgeon. He did consult across Karwar, Goa. Somehow they said you will have to go to a higher center. Finally, the patient landed up in KLES hospital at the end of 8 months of his injury. Now, I have gone through the literature. This is the longest period anywhere in the world literature where somebody has attempted to fix a fractured pelvis at the end of 8 months. At the end of 8 months, it becomes extremely difficult to dissect and disengage the broken fragments. Now, I will just show you the X-ray. Now, this patient was bedridden for complete 8 months. He could not walk. Now, this is the X-ray picture. That's 3D picture of the patient. Now, if you see here, you will find that the pelvis has ripped open right from the upper part going right down. So this is a pelvic acetabular fracture. This is the front view and this is the back view. We had explained to the patient that we do not guarantee you an absolute hairline reduction. However, we will ensure that we will be able to make you walk. Now this surgery does carry its own mortality, sometimes even death on table, because there are large vessels involved here when we dissect. Now this surgery was done by a team of doctors which included me, Dr. Sahil Kale, and a colleague of mine who is also an extremely renowned pelvic acetabular surgeon from Bombay, Dr. Pradeep Nemade from KM Hospital, Mumbai. It took us 9.5 hours from skin to skin to finish this surgery. We had to infuse 4 bottles of blood. In the field of orthopedics, this rates as the highest degree of surgery next to cervical spine injuries. Now the peculiarity of this surgery is we have to flip the patient. First the patient is supine, that means lying on his back. We have to go in front, dissect everything out, leave that area, again flip the patient lateral, go behind, dissect everything. So now the 2 fragments are separated. Again flip the patient supine, plate him from inside, and again flip the patient so that we fix the back side. At the end of 9 weeks, we have allowed the patient to sit up in bed. So finally, at the end of nearly 10.5 months, for the first time this patient could sit up in bed. And now probably this is 1.5 years down the lane. Patient is walking. However, he is walking with support. The final X-ray is something like this. For a layman to understand is little difficult, but you will find here that the gap has reduced. To close this gap at the end of 8 months is next to impossible. If you find multiple shadows here, these are all the shadows of the plates and screws that have been fixed. As of now, patient is quite comfortable. He is walking around. He is able to go to his toilet. He is able to manage all his activities, and now he himself has agreed to go and appear for his exams which are coming next month.
मैं गोवा से हूँ। मेरा 1 साल पहले पेल्विक फ्रैक्चर हुआ था। तो मेरा 8 मंथ्स के बाद मैंगलोर से इधर रेफ़र किया गया KLE हॉस्पिटल पेल्विक एसेटाबुलर सर्जन डॉक्टर दिनेश काले के पास। अभी उससे मेरा ट्रीटमेंट चल रहा है। मैं रिकवर हो रहा हूँ। थैंक यू डॉक्टर दिनेश काले। थैंक यू KLE हॉस्पिटल।